These are all little things, right? Cancer is never caused by one thing, but most kiddos have an imbalance of maybe 3 or 4 of these areas that's helping contribute to this diagnosis.
I gotta get myself a little more faith, a little more love.
I'm your host, Krista Bigler, and I'm going to guess we have at least one thing in common, that we're both in pursuit of a less stressed life. On this show, I'll be interviewing experts and sharing clinical pearls from my years of practice to support high-performing, health-savvy women in pursuit of abundance and a less stressed life. One of my beliefs is that we always have options for getting the results we want, so let's see what's out there together. Today on the Less Stressed Life, I have Dr. Dagmara Beine, who's revolutionizing the pediatric cancer world. She holds a PhD in Integrative Medicine and has over a decade of experience in the emergency medicine, as well as being the CEO and practitioner at her Wisconsin-based integrative health clinic, Zuzas Way. Her expertise is only surpassed by passion, which is fueled by the fire that burns within the soul of a mother whose child has battled cancer, which just hits a lot. Her daughter's 4 fights against AML lead Dagmara being steadfast in knowledge that there's a better way. Led by this passion, she is uncompromising in her treatments of patients as a whole, looking after their minds and bodies. She uses a terrain-based approach, including modalities such as lifestyle modification, Mistletoe therapy, LDN, Ozone, targeted supplements, and more. Her new book, An Integrative Approach to Pediatric Cancer, will be coming out soon, making waves through the world to treat pediatric cancer patients in a better way. Welcome, Dr. Beine.
Thank you so much. And actually, the book title has changed. So it is A Parent's Guide to Childhood Cancer.
That's helpful.
Yes. Which is exactly what it is. Like, it's a guide. We had to call it what it was. It's a guide for caregivers who are on this journey and need a guide because there's nothing out there like it yet.
Perfect. Let's start with your story because it is where that passion and that fire, and that's where this comes from. I love knowing the behind the scenes of, wow, what was it like transitioning? I always love to ask people also about their transition into kind of their traditional medical into the journey that is creating their own practice and whatnot. But it's really led by this story of your daughter. So let's just start our conversation with that because that's going to guide us a lot in this conversation today.
Yeah, I was probably about a decade into working as a physician assistant, or now they're called physician associates, in the emergency department, and had a 3-year-old daughter and an 18-month-old son. My husband also physician assistant in the ER. So we were very much so in conventional medicine, maybe considered ourselves a little bit natural, but pretty conventional, which was what our training was. And our then 3.5-year-old daughter, Zuza, just started exhibiting. She was our first. So like loss of appetite and some leg pain and some mood stuff, but nothing that you could really pinpoint or that you couldn't maybe just question, like, is this what it's supposed to be like? Because I've never had a 3.5-year-old. And we took her to the pediatrician and demanded labs because it's crazy that in our conventional system, kids don't get labs. So we don't really even have a baseline of what your kid's normal is. And her labs came back a little wonky, but again, nothing that you couldn't explain by like a cold. A white blood cell count can be a little bit low when you have a cold. A neutrophil count can be a little low because you have a cold. Something just didn't seem right to us. And it took a couple of months. But eventually, on a Tuesday afternoon at 2:00, after dragging her to yet another pediatrician and demanding labs because I knew something wasn't right, I got the phone call that it looks like your daughter has a type of leukemia. And we will be contacting your local hospital, the hematology oncology floor, and they will most likely be calling you next. Your world just stopped. Cancer has this very, like when we hear the word cancer, we automatically think the worst. And we'll talk through that. There's truth in there and there isn't, because there's a lot that we can do. But our world stopped, fear took over, and then we were sucked in to the conventional oncology world of really so much more fear of we have to start treatment tomorrow. And you're like, yeah, of course, she has leukemia. We have to start treatment tomorrow without any thought or breath or how do you know she has leukemia? What type of leukemia does she have? Like you become so overcome with fear that those questions that should be asked aren't asked. And so we did what everybody else does is the next day we started chemotherapy on my 3.5-year-old daughter, only to find out a week later, they thought she had the wrong type of leukemia. She actually has AML. It was the wrong chemotherapy. You can't get diagnosed with cancer in 24 hours. You will never know what type of cancer you have until biopsy results come back, whether you're talking about solid tumors or blood cancers. And we went head on with chemotherapy. I was still very much conventional. I didn't know that there was anything that needed to be done to help support my daughter. Very fast. She had every side effect you could imagine. She stopped eating. We had to put a feeding tube in. And my first kind of aha light bulb moment was when they gave me the options of what kind of formula I should be putting through this NG tube, because she's 3.5, so it's not like baby formula. And every single thing that was offered through the hospital was just crap. It was like high fructose corn syrup and seed oils and corn. And the amount of work it took me to be able to get my daughter organic formula, and that just really snowballed. I then started looking for book information, Googling integrated pediatric support, nothing. And then I started looking for a practitioner. And there's a lot of practitioners and a lot of books who are happy to help adults, but that door gets shut as soon as they hear that it's a child. And so I didn't quite know it then. It took me about a year after she was initially diagnosed, but I wanted to become the practitioner that I needed when this happened almost a decade ago now. And so I have spent my last 10 years going back to school, being blessed to find amazing mentors in the integrative cancer world because it's a messy world just as well. And unfortunately, my daughter's journey didn't end there. She was in remission for 5 years. And she had more and more integrative support as I learned how to support her better and heal her gut and help her body detoxify. But she did relapse 5 years later from the original diagnosis. And the last 4 years have been very bumpy. So we just came home 3 days ago from her third bone marrow transplant. And I think Zuzas story, so this book that I wrote, it's not a book I'm not selling a cure. And I think Zuzas story speaks to that. But I know that there's a better way on this journey. I know that I've seen the difference now in hundreds of patients, but in my own daughter, that's where it started. What was her journey like when she wasn't supported? And how can chemotherapy and other cancer treatments look like when you are supporting them? You can make them less toxic, more effective. And I really believe that the reason she's been able to have more toxic treatment is because we've done so much through it and in between. So the book oozed out of me. I wrote it really through all her hospitalizations. I wrote it in the hospital. And it's a guide that takes a parent from literally the moment that their child gets diagnosed, if they're lucky enough. That's why I wanted a book to be out there, because they're often not lucky enough to find somebody like me or somebody to tell them to stop and breathe. But maybe they'll be able to find this book all the way through how to get through treatment, side effects, and then this whole other world of there's so much that needs to be done when we're told by conventional oncology, you're done. Ring the bell. Everything's done. You're good. That's really when the healing starts for our children with all the gut healing and everything we need to do to try to prevent relapse. So it's a guide that they can use. They don't have to read the whole thing. They can just use whatever chapters apply to their children.
Yeah, I love that. I told you, I think before we hit record, for some reason, I'm very drawn to this topic, just cancer in general. And I've been fortunate to have some really amazing interviews about the topic. Some being, I don't know if Dr. Michael Robinson out of Chicago, he's at Integrative Cancer Center there. I don't remember every detail, but
yeah,
some very good ones. And When you talk about your daughter's story initially, she has leukemia and we're going to start chemotherapy tomorrow. And that was 10 years ago. Some people, it's interesting because that was your experience. And now I wonder if the experience is sometimes different than that. Not necessarily because anyone believes that you need a moment to stop and breathe and consider the options, but because of the common landscape now. And I don't know if it's kids have a little bit of a fast track over adults where I think the care is a little bit sluggish sometimes just because there's so much coming in the pipe. But I would love to ask you about the landscape or prevalence of childhood cancer now and 10 years ago when your daughter was first started dealing with this. Like, how has it changed?
Yeah. One way it's changing is that now we're up to 46 kids every day in the United States being diagnosed. And 10 years ago, it wasn't, but now it is the number one cause of death by disease in kiddos. There is a really big difference, you touched on that, between when an adult gets diagnosed with cancer and when a child gets diagnosed with cancer in this country. And the difference is an adult can choose how much conventional treatment they want to do, when they want to start. A child under the age of 18 in the United States cannot choose. They have to go with what's considered standard of care with oncology. Otherwise, there is a real risk of Child Protective Services getting involved. And other than more pediatric cancer and maybe some things like cannabis use and some supplements like L-glutamine being more, 10 years ago when I wanted to use L-glutamine to prevent mucositis, I was looked at strangely. And now they actually handed it to me in a syringe as like one of the things that they're going to give her. There actually hasn't been that much that's changed. The drugs haven't changed because less than 4% of the money that's donated for cancer research goes to pediatric, which is insane because most of it should be going to pediatric. Because these kids have a life to live, right? And 95% of pediatric cancer survivors have a chronic late effect later in life. So whether that's a secondary cancer, congestive heart failure, endocrine issues. So there really hasn't, I feel like there's been a much bigger change in the integrative oncology world when it comes to adults. We know so much more. There's so many practitioners who practice integrative adult oncology, and more adults are looking to implement more integrative support and therapies. But in the pediatric world, maybe there's more parents that are curious in how they can support their child because they're watching some of these doctors or influencers on social media talk about cancer and how there's more that you should be doing. But it is still very much so discouraged by most oncology teams to do anything. They're just told, don't do anything. You're going to hurt your child's treatment. And it's not because they know that. It's because they don't have knowledge in what you're even recommending. And so it's easier just to say, don't do it because you're scared of it, because you don't know what mistletoe is or how it's going to affect treatment, or even fish oil, something as simple that's been studied in pediatric oncology and shown how amazing it is to have a child on fish oil. I've had them come back to me and say, oh, you can't get fish oil because it's got heavy metals in it or something. Like, it's funny what they'll come up with, but look at what they're giving your child, right?
Yeah.
In comparison.
Is that one of the hardest things for you, honestly, is when you're trying to treat in this care team and they're like, you cannot... And you're thinking, I am using the best quality fish oil that is third-party tested to not have this in the first place.
Yeah. That is the hardest part for families who work with me, because I've gotten to a point where I'm not asking permission. I know what I'm doing. And I have learned by trying to ask permission in my situation with my team that has not gone very far. So that to me is a non-issue. But for families who work with me, I feel them because I know that they're being told, don't do anything, being told this is going to make treatment ineffective. And then there's me saying, how can you not do this? This is going to make this chemotherapy less toxic and more effective. A very small example of that is there's a chemotherapy that's used in pediatrics and adults called doxorubicin. And it is a pro-oxidant and it is very toxic to your heart cells. It's used for breast cancer and it's used in a lot of pediatric cancers. And kids will literally have to stop using the chemotherapy through treatment because they begin to have heart failure, or 15 years from now, you get heart failure. Mm-hmm. And by using something as simple as grapeseed extract, we can reduce that by 80%. Why wouldn't you do that? But it's just a matter of, I've learned that it's not my job to ever convince families. My job is to give them what I would do, the best information for their child based on their child's story and labs and epigenetics and their treatment plan. And it really needs to be up to the parent to decide what they want to do, because it's me. Usually most of my patients at this point are virtual. So it's me in this little Zoom box against a team of like doctors at a huge institution in white coat. And that can be intimidating, right? To say, how could they not know? Because they're experts in chemotherapy. They're experts in radiation. They're not experts in your child's terrain. They're not experts in nutrition. I think that's the difference parents don't understand.
One thing I feel really comforted by now more and more after I've done some of these interviews and gotten on the trail of some things is the good news is that we do have a lot of amazing resources out there related to integrative oncology. I think yes. Compared to what I was expecting. There are some textbooks that are a little more conventional. There are some physical and digital textbooks that are not so conventional, a little more integrative, right? A lot more supplementation. And I'm so thankful for any trailblazer in this area, because I think one of the reasons I know why I'm so touched by this topic. As soon as someone near you is diagnosed that it feels unfair and like, why would this happen to this young person? And if you're close to them, like you, it's like totally different. Like you just have this stark, we all just have this epiphany on how we come about things. And then of course, with cancer rates approaching 1 and 2 in adults, I can't really see how this is acceptable. So I'm just like, I feel drawn to it because it's not that I don't have any choice, but this is going to be here regardless. I'm just going to get ready for it. And as soon as I said that, they came to the door almost as well.
Yeah. It's really good to start having these conversations. And I think with pediatric cancer, it's such a hard topic for people. And I remember that. I remember being a young mom and just the idea when Zuza had abnormal labs that she might have cancer, and going to the hematology oncology unit before we knew she did, and seeing the bald kids in the wheelchairs. And it's too hard to think about. And so we shut out like, oh, that's just a kid on a poster, right? That's not my kid. That's never going to be my kid. But now the statistics are becoming pretty significant for cancer in general. Like we're at 1 out of 2 or 1 out of 3 if you're born now that you're going to have a diagnosis, whether that's when you're young or when you're 30 or 40, which is now the new kind of time where everybody gets diagnosed. But I think it's really good to start having conversations around, even in pediatric cancer, most of the time, 95% of the time, it's preventable. It is not just bad luck. And I think that's really hard for people to grasp. When we think of an adult who gets cancer, we're like, okay, we think of smoking and drinking and eating crappy. And we're like, okay, that sort of makes sense. But when a child gets diagnosed with cancer, it gets flipped upside down for us because we do, but a lot of people don't know how toxic our world is. And the babies are so little. They're born, umbilical cord blood now has over 200 toxins. And their little kidneys and livers can't process the amount of glyphosate that's being sprayed in the golf courses and by their neighbors and that's in their food. Toxins are that's the world we've created, unfortunately. But I want parents to listen to conversations like this, to be brave enough to listen when they're not on a cancer journey, to hear there's things you can do in your life to prevent cancer in your family. And that includes your kids.
Yeah. I want to talk about all those things, but I don't want to talk about terrain, and it's going to overlap for sure. Yeah. I see a lot of kids with skin issues. To your point, these are immature detoxification systems. And guess what? This same stuff if your child has a skin rash, they're not necessarily going to have cancer, but learning how to support the systems that create that is going to support you. You don't know about the cancer you never are going to have, right? So that's
Right.
a good feeling. Is I go forth in life of, oh, I'm just after you start to understand physiology, which is my approach.
Yes.
I'm just going to support these systems to function more properly than they
Yes,
do in the toxic soup.
Because we all make cancer cells. We
Right.
all make them. It's just that our immune system, our terrain, our environment, like we've made it healthy enough if we haven't been diagnosed for us to never know about it. Right.
Yeah. I also wonder if we would all go looking for it, if we would just find it as well. We're having that internal conversation in our team with some, and I'm neutral about it. I don't have necessarily a feeling, but there's some advanced scanning technology now, right? That's becoming popular. And I think to myself, if I go look for that, I think I'm going to find it, which is fine. I don't have any opinion about it. I just feel like we have this, and are we clearing it? Or is it turning on? Is it becoming malignant, et cetera? So we talked about, you mentioned terrain a couple of times. I love asking people about their definition of terrain. How would you describe it to someone who's, I don't have any idea what you're talking about, Dagmara?
Yeah. So the way I explain it to parents, I usually have two stories and neither of them are original for me. I'm sure I've taken these from somewhere. One way that I describe to parents how I function differently than their oncologist is the weed, right? If cancer is a weed and your oncology team wants to get rid of the cancer, they're going to pull the weed, so surgery, or they're going to spray it with a whole bunch of pesticides, toxins, chemotherapy, radiation, and they're going to hope that weed never grows back. I'm going to look at the soil that the weed grew in, and I'm going to say, what's wrong with the soil? Let's look at everything that's in the soil and let's balance it so that this weed doesn't grow back. Another way that I explain it to my families is a fish in a fishbowl. So if you take a fish, let's say you have a fish in a fishbowl and you just haven't been taking great care of its water and it gets murky and icky and the fish doesn't look so good. So you take the fish out and you fix it. It doesn't matter how you fix it. You fix it with chemo, radiation, high dose vitamin C, mistletoe, you fix it. If you take that fish and put it back into the same water, it's going to get sick again. That same water represents what we refer to as our terrain. Our terrain is all the things internally in our body and externally in our environment that affect us positively or negatively. So I talk in the book about 7 broken terrains with the permission of Dr. Nasha Winters, who originally came up with the top 10 broken terrains. I got rid of some that didn't apply to kiddos, combined some, and came up with epigenetics, which are huge for kids. They're huge for all of us. You are born with good genes from your parents, and then you also get epigenetics, and those are just hiccups. And they're hiccups that sometimes can be good for you and sometimes can be bad for you. And there's some very common hiccups that kiddos who get diagnosed with cancer have. MTHFR, PON1, you can get into them or not, but there's some just very common ones that I see. Our kids' blood sugar. So 1 out of 4 kiddos right now are pre-diabetic. So that doesn't cause cancer, but it helps contribute. These are all little things, right? Cancer is never caused by one thing, but most kiddos have an imbalance of maybe 3 or 4 of these areas that's helping contribute to this diagnosis. You can look back and say, oh, that's probably why they ended up getting diagnosed. Toxicity. So we've touched on that. I'm really big on glyphosate. I think it's a big contributor to pediatric cancer and leukemias and lymphomas. If you look at a graph, when glyphosate was introduced into our food system and our everything system, it literally goes up as pediatric cancer goes up. So there's just no denying it. And most kiddos who I test, we all have glyphosate toxicity at this point. No one's at 0, but they're through the roof, like 900%. Crazy levels. Our microbiome, if we're a C-section baby, if we were breastfed, if we got antibiotics under the age of 2 or 12, all those things affect our gut health. And gut health is very important going into treatment because we do have multiple studies showing us that you may be a lot less responsive to treatment if you have an unhealthy microbiome. Our immune system. So when I think of our immune system, I think of the child who got way too much Tylenol because mom and dad were just doing what they were told. Inflammation, I think of the child who got way too much steroids for that eczema rash. Again, eczema is not going to ensure that your child gets diagnosed with cancer, but it's all these little decisions. And then stress and mental health. We also have an epidemic in this country right now with kids and young adults and their mental health and anxiety and depression. And I do think, and we have studies actually on pediatric cancer and HPA access, so their stress response and how that affects their treatment. So all those things, with an adult, you look at what contributed to your cancer first because you have time. With a child, we look at how can we support your treatment? What do we need to get you on? What should you be eating to get you through treatment? And then when the dust settles, then we sit down with parents and talk about, okay, let's figure out through testing, through the story, what helped contribute to your child's diagnosis. And then let's focus on those areas. And what can we do to clean up those areas in your child's life? So if it was toxins, what toxins? Where are they coming from? Where can we do better? Is it in the non-organic food? Do you live behind a golf course? Or is it microbiome? Oh, your kid got 4 antibiotics in the last year for an ear infection. What can we do if an ear infection comes up again that's not an antibiotic? So we try to focus, because this is such an overwhelming journey. You really have to just take little baby steps in empowering and educating parents.
I want to mention one of my first interviews that really made my mouth drop open it was episode 80. We're in like the 300s now with Dr. Arthur Frankel, and he was so cute. He was transitioning between institutions because he was having this epiphany with all of his research around microbiota, and then he wanted to find an aligned institution to work with. And I don't know what happened to him, but he was between institutions. And I remember he did this mouse study and he said it was so annoying because we just had to feed him all these little things, right, around microbiome. And essentially, and I don't remember the results, but he said they were so ridiculously different. Like the cancer was so much better when the microbiome of the mice was better. I didn't even submit it because they wouldn't have believed me because it was so dramatic, essentially.
Yeah,
and so
it's
I think
so
about
dramatic. That. Yeah, there's a lot of, most studies, unfortunately, are on adults, not on kids, but there's a lot of adult studies coming out specifically with immune therapies, because immune therapies are like the next conventional treatment on the rise. And in what a difference having a healthy microbiome makes versus sometimes they're just ineffective because you came in with, I would say most people come into treatment with a broken microbiome.
Sure.
Same thing with like low dose naltrexone. So low dose naltrexone and certain chemotherapies like the platin, so cisplatin and carboplatin, you could have somebody, and those are also used a lot in pediatric cancer. You could be on chemotherapy that's in this class and not be responding, and then start taking something called low dose naltrexone, and it can literally make treatment effective.
Yeah,
So
why do you think that happens with LDN?
I always tell families it's just this like magical little guy that goes in and makes your immune system smarter. We don't know.
I know,
but
LDN perplexes me sometimes.
Yeah. But I love it. There's no protocol. I don't put everybody, there's no such thing like, oh, you have this type of cancer, this is your protocol. You don't want to work with anybody that does that, because that's exactly what conventional medicine is doing. You really want somebody who's going to look at your child's labs, your child's epigenetics, and your child's terrain. But the one thing that I can say I have almost every single one of my patients who are on a cancer journey on is low dose naltrexone. The only time I don't use it is if they're on like high dose narcotics, which doesn't happen very often with kids.
Mm-hmm. I've heard you mention a few other integrative treatment options, including mistletoe, including high dose vitamin C, and any other ones you want to mention. And my question is, do you ever struggle with accessibility or ability to, because if you're working virtually with people at a distance, do you ever struggle with accessibility to some of these treatments for people?
Yes. So I'll go over some of my favorite treatments that are simple. So things that I don't struggle with, that I love using in many cases. I love full spectrum hemp oil. So a good quality, people refer to it as CBD oil, but CBD is just one of the cannabinoids. In fact, it made such a difference in Zuza's journey that we are blessed enough to have a farm that's never been touched by pesticides. And my husband ended up growing our own and creating a company where we now know that hemp oil is clean, right? Third party tested, because it's an industry that you can get really icky stuff. So yeah, I love full spectrum hemp oil because you can avoid or you can treat nausea, vomiting, insomnia, pain, anxiety with one thing. And it's non-toxic and it's anti-inflammatory, right? So there's a few chemotherapies and immune therapies where it does interact. That's why it's important to work with somebody, but that's up there for me. I love vitamin A, D, K, like for D3, K2, vitamin A. Then I will have my kiddos on a methylated B complex, but not with methotrexate. Fish oil we've touched on, sometimes shark liver oil, but it's a dirty oil, so it's very short-lived if I use it. L-glutamine, very short-lived, pulse. And fermented wheat germ extract has great studies on pediatrics showing that it will reduce neutropenic fever in kids. So that's awesome. And then low-dose naltrexone, also fairly easy. Where it comes to other therapies I love that is a little more challenging. So mistletoe, I will almost always recommend and prescribe subcutaneously. And we, at this point, we have a beautiful nurse named Heidi in our clinics. She does all the mistletoe therapy training, and we do training virtually and families learn. So mistletoe, for the parents who are brave enough to inject their kids, which most kiddos do so much better than we make up in our heads they're going to do. It's fairly accessible. And we're so lucky to have a Uriel pharmacy in Wisconsin, actually, that makes mistletoe. Where I run into trouble is more of those out-of-the-box therapies that I love to use. So even something as simple as high-dose vitamin C, which I love, there's a lot of places that will not access. There's all these boutique or integrative places that do IV therapy, but they don't feel comfortable accessing a port or a PICC line.
Sure.
And I would say 100% of kids going through treatment have a port or a PICC line, and no parent's going to take their child who has access now be poked again.
Yeah.
So that becomes a problem. And then therapies like IV artesunate, dichloroacetate, some of these other really cool therapies, most of the time families have to travel because there's very few integrative practitioners who are brave enough, usually for medical legal reasons, to work with pediatrics, especially when it comes to like more out of the box therapy.
Sure. Will you describe those last two you said? I don't know what those are.
Yes. So artesunate is an anti-malaria drug. It's used as an anti-malaria drug in the United States, and that's the only like FDA indication for it. It also can be a phenomenal anti-cancer drug, especially when used in conjunction with high-dose vitamin C. So there are situations where it makes sense, not a lot, but there are situations where it makes sense to use that in an IV form. Now, you can do by mouth, but anything IV is always going to be better than what you can get by mouth, especially for a child going through treatment because they're not absorbing very well.
Right.
And then DCA, dichloroacetate, is a chemical that used to be used in the emergency department for diabetic ketoacidosis. So it works in a metabolic way. And you want to ensure that the child is as close to ketosis as possible. So it exposes the cancer cells. And then the dichloroacetate is an anti-cancer IV, is how I explain it, used with another IV called poly, because the only, not very common, but potential side effect of DCA is reversible neuropathy, meaning like a kid can be sitting there and be like, Mom, my leg feels weird. So to prevent that, we give something called poly-MVA, which is alpha lipoic acid and lots of B vitamins to help prevent neuropathy. And that protocol is usually in combination with a hyperbaric chamber. And it was created by one of the best integrative oncologists that we have, Dr. Paul Anderson.
He's on my calendar.
So, yay, he's one of my favorite people. So he created that protocol, DCA with poly-MVA and hyperbaric chamber. And I have, in my practice, had some amazing results on kids who have been told there's nothing else that can be done, because it made sense for them. And it was a family that was able to really keep their kid in ketosis. And yeah, so it's not one size fits all. Everybody should do this, but there are some really cool, the next exciting thing for me for therapy is going to be the phototherapy. So there are lasers where you could have a photosensitizer. So IV curcumin, for example, or oral curcumin is the photosensitizer. And then if you hook up yellow light as an IV and give the yellow light with the IV curcumin, you're making that curcumin like 100 times more bioavailable and effective. And heat therapies, so different forms of hyperthermia along with the light therapies. There's some really, I think we're just learning more and more. And unfortunately, I don't know how much of this is ever going to make it into conventional medicine. It takes 17 years
Right.
for us to learn something, and maybe it'll get there. But usually if it's not a big pharmaceutical drug, it maybe never makes it there. But those are some of my favorite therapies. Obviously, my patients who are in a different state or in a different country or can't travel to me, I try to find a colleague that is doing similar things when I can, but not everybody lives at a place where they have access. But there's so much you can do without these. I don't want people to think that's absolutely necessary. There's so much you can do with just nutrition and fresh air, nature, grounding, sunshine, and some simple supplements. And Mistletoe is accessible because everybody can get it, and you can inject your child. You don't need anybody to do that for you. That's something that we teach our parents.
Will you
That's
describe
important.
what happens when people use mistletoe in conjunction with their other therapies, or the benefit again? If you're urinating a lot when you're drinking water, maybe you're not actually hydrating that much, or in other words, getting the fluid and nutrients into the cell. Electrolytes are minerals that help fluid and nutrients get into the cell. I recommend all of my clients start by drinking electrolytes when we begin our work together to improve energy. And then we get even more strategic with our electrolyte recommendations as test results come in. Now, generally, electrolytes are potassium, sodium, and chloride. One of my favorite electrolyte products is Pickleball Cocktail from Jigsaw Health, because it's one of the only products you can get with an adequate dose of potassium to meet my recommendations, which is critical for blood sugar, which everyone should care about, hormone health, and digestion. Huge thing for relapsing digestive issues. Jigsaw Health is also maker of the famous adrenal cocktail, made popular by the pro-metabolic corner of the internet and root cause protocol, as well as a multi-mineral electrolyte for recovery called Electrolyte Supreme. You can get a discount on all of Jigsaw's amazing products, including Pickleball, Electrolyte Supreme, and Adrenal Cocktail at jigsawhealth.com with the code LESSSTRESSED10. That's 3 S's, LESSSTRESSED10.
Yeah, so I think of mistletoe in two different ways. Mistletoe therapy, for example, for certain cancers, I'll use blood cancers for acute leukemia, because it's not true for chronic, but for acute leukemias, I don't feel that it's curative. I feel that mistletoe therapy in that situation definitely help reduce side effects during chemotherapy.
Mm-hmm.
It helps reduce neutropenia. Your white blood cell count, your neutrophils aren't going to crash as hard, so you're not going to have as many complications, infections, mucositis, all those things. And then after you're done with conventional treatment, mistletoe, once you start it, we always tell every patient you want to commit to it for 1 to 2 years. So it's not something we're just going to do for a couple of months. Studies show the best benefit overall for any type of cancer is at least 2-year use. And so it helps children recover, just get through treatment better. But if you take a cancer like osteosarcoma, there is a study and it's a pediatric oncology study, which doesn't happen often. Osteosarcoma is bone cancer. There's a study that shows for kids who had relapsed osteosarcoma, then they had surgery and they had clear margin. And they gave half the group chemo that's usually used then, called etoposide, and the other half they only gave mistletoe. And years later, the chemotherapy arm had 0% survival, and the mistletoe therapy had 56% survival. So when I think of mistletoe therapy for the umbrella of sarcomas, because there's lots of different types of sarcomas, I do think of it as contributing to their prognosis and helping attain remission.
That's a really big statistic. I'm surprised. One of the reasons I would guess that we don't have a lot of pediatric cancer studies is just ethical.
Yeah.
So it's crazy. And maybe it was a choice, right? It was like, hey, we're doing this study. Which thing do you want? I have no idea. But and it was 10 years later. So there's hindsight's 2020. But if that would have been a short-term thing, they would have been like, abandon ship. Everyone's getting mistletoe. It's unethical not to give them the mistletoe. But it's so crazy. How old was that study?
I want to say it's quite old. It's early 2000s.
Oh my gosh. So we've passed the 17-year mark, guys, on that one.
And it's so sad because if that mistletoe would have been a pharmaceutical drug, like there would have been, everybody would have been on it. I'm so glad for that study because I feel like because I have it, I can usually convince conventional oncologists who have patients with osteosarcoma to use mistletoe.
Right.
In families who need oncology to be okay with it. So there's tons of families. There's families who are like, my oncologist has to know everything we're doing or else I'm not comfortable.
Sure.
And that's hard because it often means we end up doing a lot less. But that study helped. And actually, I was just watching, somebody brought a podcast to my attention. And it was brother of a boy who had relapsed osteosarcoma. And then I heard them say, yeah, I heard Dr. Dagmara Beine say this study. And they were in that situation and they ended up using mistletoe and he ended up getting a cure. It's just, right? It's just more, every osteosarcoma family could hear about mistletoe.
I know. Yeah. Now I just want a whole folder of all pediatric oncology just to read, just because, right? That's the kind of stuff, like pediatric integrative oncology, right? Because you don't know what you don't know. But I was most surprised out of you saying that, one, by the drama of that outcome, and two, by how long ago the study was, right? And that's the good news. There is some research and evidence for things, for lots of things. There's plenty of opportunity. I think that's always my takeaway here is there's always an option, typically, right? There's always an option.
There's always an option. And even if I think Zuzas is a really good example of, I get a lot of questions. I get a lot of messages of confusion of like, why are you in the hospital and she's getting this toxic treatment when you do integrative oncology? Like, why can't you just make her better at home?
That's what integrative means.
And of course, we've done everything to avoid a chemotherapy. But I think that's the other thing that people need to know, like chemotherapy and radiation. Yes, they're toxic therapies, but oftentimes they're needed and they can be life-saving if they're used in the right way. So it isn't this like one or the other. And oftentimes pediatrics don't get to choose. And by the time you get to choose, it means that you're not doing well. We've been given the choice at this point because if an option is palliative care for you, then that's when integrative care becomes an option, which is just terrible because it should be.
Yeah. I think that's really important for us to process that you don't have a choice as a parent unless you want social services to take over your child, which is crazy. Crazy.
Yeah, you don't have a choice. No, I've been a part of, which brings us to how important it is to choose your conventional team because your relationship with your oncologist is going to determine whether CPS gets called or not. And a really good example of that is, so you go into a meeting and you say, okay, I'm looking for an oncologist who's open to integrative support, who understands nutrition is important. And if your oncologist says no, like that's the wrong oncologist for you if you want to go down this journey, because it's not just saying no to treatment. What happens, most parents don't want to say no to all of conventional treatment. That's usually not the situation. Usually what the situation is, you start treatment, your child's kidneys or liver are failing, and conventional team wants to continue pushing. And either the cancer or the treatment that's going to take your child's life. And you need a good enough relationship with that oncologist that you have somebody like me on board, you have an outside of the hospital nutritionist on board who can then help your oncologist come up with a plan of like, how can we support the liver so we can do a little more chemo?
Right.
How long can we pause therapy so we can help the kidneys in between. And then it really becomes teamwork, which happens, but is very rare.
It makes me want to ask about verbiage for if the standard of care for pediatric cancers, we're going to start treatment tomorrow. Could I have 48 hours to breathe for a second and think about things? Do you think how do you think someone could ask for that?
Whoa, this is a lot for our family. We just need a moment to process this. We don't even know 100% what the diagnosis is. Is it safe for my child to stay under your care in the hospital and get IV fluid and for us to get to know each other and wait for results while we find out and wait and just know what we're dealing with? And we'd also like to get a second and third opinion because that's what we've been advised to do once we know what the diagnosis is. And then we can decide how and where we want to move forward. I always joke, like, the other reason why there's so few integrative pediatric oncology practitioners is because you're taking care of the whole family. You're taking care of the mom who's just barely breathing. You're taking care of the dad who's completely reacting differently, like falling apart, but differently. Oftentimes, I'm taking care of a couple who one feels very strongly about integrative support and the other doesn't.
Yeah.
You're taking care of siblings. And so one of the best things that I can do is empower parents. They need to know they are hiring the team. So it often feels like they're hiring me because I'm outside of insurance and they've had to look for me. But no, you're hiring your oncology team too. You get to decide who's going to be able to take care of your child. And so I think if they look at it that way, if that oncologist walks through the door and he doesn't look in your eyes and barely looks up from the computer and like you get a bad vibe, like why would you go with that? And parents also need to realize 99.9% of the time, nothing will happen bad if you wait a week, 2 weeks, 3 weeks, 4 weeks before you start treatment, because this cancer did not develop overnight. Yes, there are situations where you hear of emergent surgeries or something's pressing on the heart and they need to do something. But 99% of the time, it would actually serve your child to not rush into treatment. You can prepare your child for treatment. You can change their nutrition around. You can start to give them probiotics for their gut. You can hydrate them. There's just so much that can be done to prepare for treatment and get to know your team at the same time. So one of the chapters in the book is all about who to hire, how to talk to your team, how to not rush into treatment, and like all the typical kind of questions or things that an oncologist would say to you and what to say back, because I get asked a lot. And there's a lot of fear, unfortunately, that's put into an already fearful situation. And parents cave because I don't blame them.
I
We
get
did
it.
too.
I understand completely. There is fun. I align with you a lot, right? I love using the soil as the best analogy for terrain. What's hilarious, but not hilarious, probably extremely intentional, is it's so crazy. The more you learn, the more you realize we are just a mirror of nature, actually. Like the same stuff that happens in nature does happen in our microbiome.
Yes.
It is extremely parallel. So it's pretty sweet, actually. It's pretty sweet. So look to nature. There's a reason we often talk. I was talking about this morning with clients. I have some concerns, and I'm sure there could be a part 2 here, by the way. We did not get to fully, like, how do you prevent cancer in kids before and after? And I think there's lots of room to discuss that. But in practice, if I'm dealing with skin issues, I'm looking at all those root causes. We're talking about mold. We're talking about all the things. And it's like, how did we get here? How did we arrive here? And some of it, there's so many options. It's not like one thing, I think, necessarily, but it's also, we did probably spend more time outside once upon a time, right? And now we spend more time inside. And there is something, I love talking about the nervous system. And I remember also my very first conversation with Dr. Elisa Song. She did this beautiful, by the way, she is like the holistic integrative OG doctor, right? So you probably know her, but just in case someone doesn't know her. And I remember she just started talking about her pediatric patients' nervous systems. And I was like, how wonderful that we're having this conversation across the board, because as a parent, to your point, it is mirroring to the child. And when we
Yes.
get into nature, there is all of this stuff because nature has a lot of energy to it. And when we spend 15 minutes, I think this stat was 15 minutes in nature is like 2 hours of stress resiliency or something like that. So if we can just be outside all day, we can get a whole week's worth of benefit in.
Yes. I talk about the last chapter of the book is how to heal the family. And I talk about, and I think that's the hardest part. I think it's easy to follow how to eat, what supplement to take.
Oh, yeah.
But when it comes to how broken a family is, I call it beautifully shattered. And then you have an option to put your family back together. It'll never be normal again, but normal, what we say, like back to normal. Let's go. There's no such thing ever again. But healing the family is so important. Parents need to heal themselves because our kiddos feel our energy. Like they know. When I talk about all the different healing modalities, as simple as grounding, right? Forest bathing. And then I get into some other like psychedelic therapy, microdosing, ketamine therapy, neo-emotional release. I love what's happening in the mental health movement and how families can now start to heal versus we used to just think of therapists and talk therapy. And I think that talking about what you just went through may be helpful, but I think there's so much more that we need to do for our body.
So many opportunities. And that's the good news. We don't have to look at that as overwhelming. It's, oh, wow, I have many options and I pick a couple from different places.
Yeah, exactly.
Little piece by piece. We could keep talking about this. Hopefully you'll come back for a part 2. When is the book coming out?
The book is coming out May 16th. It will be available on Amazon and Chelsea Green website, who's the publisher. And then there'll be a pediatric course rated towards parents coming out in June. And that will be off my website at zuzasway.com.
Oh, how wonderful. I was thinking that there needed to be, there's a lot here.
Yeah.
A lot.
Yeah.
A lot.
Oh, it's a lot. Yeah.
And I think my brain, just in the way I was going to ask you, like how long sometimes, there's obviously no set duration to those children's treatments, but I was wondering how long sometimes you're supporting them through treatment before you even get to the prevention in the next step.
Yeah, the most common type of cancer is acute leukemia, and that treatment is one of the longer ones. It's 2.5 years of treatment.
Oh,
so,
wow.
I would say otherwise for solid tumors, a typical treatment regimen lasts about 6 months if there's no relapse or complications. So I'm with my families for years.
Yeah, right.
For years.
Yeah, and I can tell that maybe you were already this soothing force, but I can tell I think you're a really grounding presence for your family.
Oh,
quite often.
No, it took me a really long time to get here.
Completely.
It took me a lot. Actually, I would say this started 10 years ago. So I've had lots of time to try to not react so much, but respond. Lots of relapses and lots of opportunity to be the woman and like the human being that I think I was meant to be. There's a reason why this happened to our family. Zuzas is my greatest teacher. I can't believe I wrote a book on pediatric cancer. I would have never become the person I am or been deep and who I am if it wasn't for what my daughter has had to go through. So I'm forever grateful to her and sad at the same time that she has had to continue to endure what she has had to endure. But she's here and she's rocking it, and she's 60-something days away from her 13th birthday, which is all I hear about. And we're home from the hospital and we're healing. We're blessed.
Yeah, for sure. And your website, is it Zuzas Way?
Yep, it's zuzasway.com.
Yeah, perfect. Thank you so much for coming on today, for sharing your story and so many useful nuggets for this undoubtedly challenging, but more prevalent scenario that many people find their way into. If you're listening to this, I hope you share this with someone who needs it, someone who's on your heart. And I hope that we get to do a part 2.
Oh, would love that. Thank you for having me.
Just keep breaking.